teacher would be right there. Hold on, hold on.
Hey, I heard you have a present for me.
Your time is running, so I would encourage you just to forget about that.
Yeah.
Okay. According to the National Conference of State Legislatures, as of 2001 and 2002, 14.7% of the Oregon population were without, sorry, I forgot to correct that, were without health insurance coverage. This percentage is said to be fluctuating over time. And more so, the most recent estimate done by the U.S. Bureau shows that 15.9% of the U.S. population are without health insurance. Okay, so sometimes you might be thinking, my tuition fee is so high, I don't know how I have to pay all this cost. But one thing I'd like you to know is that some of the things that makes up the tuition fee is the components that the costs that are within the tuition, and part of that component is the health fee, which makes up about 7 to 12% of the total cost of your tuition. Sorry, 7 to 11% of your total cost of tuition. So that's one of the reasons why your tuition is so high. And because we actually can't do much about changing the fact that health cost is being added to our tuition fee, whether you like it or not, we can't do much about that. So one thing we can do is that we can make use of the opportunity of going to the health center. So I would like to encourage you all, as I'm focusing on 3 main points today, that you go to the health center for various reasons. One is because of the increased benefits and the services that have to be offered at the health center, because they have so many improved services of late. And also another reason is the cost of their services when you compare their costs to other costs out there. And thirdly is the flexible payment option that the health center has. Okay, for the benefits, when you look at the primary health care, you have to pay about $122 or $135, depending on your credit hours, that I already emphasized on my informative speech. But also I'd like you to know that in other areas, when you go out in the community, you pay at about $125 to $165 for a comprehensive exam. That's just for a day. But in the health center, you pay the $122 or $135 for a term. So that's an added advantage of the benefits. And also in the dental area, because the appointments are so high of late and so many people like to go to the dentist, so one of the things they're doing to improve the services in order to cater for every student is renovating the dental office. So the dental office is currently on renovation in order to cater for the mass amount of students that will be going there for dental needs. And secondly is the, sorry, I missed out on my point. Okay, the third reason is that you have flexible payment options. When you go to the dental office, say for instance, you are a student without health insurance, but you have no money to pay, the health center have an option for students. You can be able to put off the amounts by them charging the amounts into your BandWeb account, and the amount can be withdrawn when your financial aid comes in. So you have an option there, whereas if you go outside, you can be able to pay the amount if you don't have the money with you. So as I've said, I'd like to emphasize on these points again, that the health center offers so many benefits which you have to consider in order to go to the health center, because as students we really need health care, because we are most times studying and we might lack some of the necessary things our body needs. So we need to go to the health center frequently. And the second point I want you to note down is that the health center has improved on their services, and thirdly, they have flexible payment options. To wrap up this, I'd like to give you a narrative. In my country where I came from, in my college, the college I was in, we never had anything like a health center. So that's one of the reasons why so many students kind of pass out in the exam hall while they're taking their exams back home, because we don't have much facility to healthcare in the college. So if you're sick, you have to go find a way of treating yourself, but you don't have to bother anyone in the college, the authorities or anything. So we have the opportunity here now. I'm emphasizing on the point that we should make use of this opportunity, because there are so many other people out there who are trying to make use of the services but can't afford it. So if we have the opportunity available to us and they're already charging it automatically into our student accounts, we need to make use of the opportunity. So as I've said, I'd like you to look into this and make a quality decision and visit the health center. Thank you.
Questions? Crystal?
Melrose. Do they fulfill chiropractic needs at the health center?
Yeah, I think so. They do. They don't? I don't think so.
you're so cute.
There are chiropractic, they will give you an option to go out and get it in the community. If you pay for the extended plan, which is above and beyond the $125, $135 you naturally pay, then you can get benefits out in the community to go see outside therapists,
I have